All right, welcome everybody. Thank you for those of you who are joining us, and we know that participants are going to be filing in as the webinar gets started. So my name is Melissa Gray, and I have the privilege of introducing us today. We're here for a webinar, LGBTQIA+ care, community, and healing amidst COVID-19, an APA Division 44 webinar. And we're going to spend most of the time talking to our panelists today. And one of the things that we'll say a couple of times is to please send your questions through the Q&A box. And so you'll see that down at the bottom part of your Zoom webinar window. We're going to be having a conversation with Mira Jourdan, who is going to be moderating. Who's also president-elect of Division 44, and we have Arlene Noriega, Darren Freeman-Copage, Lex Pulice-Farrow, and David Pantalone are all going to be in a conversation. Myself and Carlton Green are helping a little bit behind the scenes. And part of the reason that we're coming in and sharing this webinar today is because we know that there are a lot of challenges happening, including some physical distancing and difficulties making connections and maintaining self-care and community care as we're facing a global pandemic. So we wanted to bring together some of the great minds and hearts of Division 44 and share some space with everybody who might be interested. So I wonder, I'm going to say one more time, there's a Q&A box at the bottom window of your Zoom screen. And so if you have questions or would like to send in something, please use that rather than the chat box. And could I pass it off to you, Mira?
Thank you. Thank you very much, Melissa and Carlton, for putting this together. We're really happy to connect with you. And as we've been meeting in division leadership, we've been talking about ways that we can be more connected as a division during this really unusual time. A lot of that also involves being gentle with ourselves. I tell people that the last time something like this happened was around 1918. And so none of us has institutional knowledge about the things that we are going through right now. With that being said, we've brought together a group of people. This is exciting. We have people at various phases. I believe we have people at the grad school and fellowship level. We've got some more senior career professionals as well. I'm just exiting the early career psychologist phase myself. I got my PhD 10 years ago in August last year. And so I'm going to ask some questions and give opportunities for each of the members to respond. And if you'd like, maybe Carlton, if you want to turn the screen sharing off. Perfect, and that way you can see us. All right, so, I would love to hear from everybody. So the first question I have for our group is, what have you been doing to care for yourself? Given all the roles that you hold, both as a psychologist and in your communities, with your friends, with the people you interact with professionally, and with others in your life, what has your self-care been like during this pandemic? Arlene, I'd like to actually start with you. We had the chance to talk to each other before this, and so I got to hear some really great stories. And Arlene, you had been doing some work around mindfulness practice, and I was hoping you would share that.
Well, let me tell you how I came to this first. You know, self-care pre-COVID-19 for me personally was very externally focused, very dependent on other people, and very dependent on my physical body. So we're talking the nail salon, the hair salon, massage studio, the gym, trainer, restaurant, social events, you know. And I really came to see when the external environment now gets constricted, when our social distancing eliminates that, you know, what happened to my self-care? You know, and I had to really think about this very carefully. And so I started to formulate a more internally based self-care process. I took a look at what I did, setting up a schedule for myself, setting up a routine. And in that process, I used to dabble in meditation, but never had a practice per se. And in this routine, I wanted to put in more meditation. So at first I started in the morning with just a mindfulness practice, being present where I was. I wasn't at the office. I wasn't, with the people that I love. I was here. I was, what I do. And so I started developing these wonderful self-care rituals that I even developed, put in a second meditation, gratefulness journaling, and doing a great deal of things, cooking in a mindful way around issues of nurturance. It's about doing things and being present. It's about putting down the phone. It's about, just being where you are.
I really appreciate that. I feel like, I practicing yoga and having done mindfulness work for a long time, I feel like mindfulness was almost at its peak commercialization level before all of this happened, and so like mindfulness had become this very commoditized thing, like what app do I need to buy? What device do I need to buy? Like the rose gold prayer beads, or, all these kinds of things.
None of it.
And then of course too, with like these other self-care rituals, my feet could certainly use a pedicure, but it's not the way that we get self-care right now.
No, it just didn't seem important. Now, don't get me wrong. The moment I can safely go get a manicure, that's where I'm going to supplement. But, and in Georgia, you can. Apparently you can go to and get your nails done, but I am not. But it was really about taking a look at the internal process. Because there was so much flurry going on around you that you could get caught up with this, and the anxiety and the depression can go high. So how is it that you maintain your grounding in all of it?
That really fits with John Kabat-Zinn's book, Full Catastrophe
Yes.
Living, is a lot of Western psychologists' introduction to this area, and it fits with that idea very well.
Exactly.
Would anybody else like to share their experiences in self-care? I would love to hear more.
I do want to give a shout out to all of I know that there are lots of attendees who are perhaps not psychologists, but a lot are. And I want to give a shout out to all the psychologists who kind of suck at this right now, like me. I'm, self-care for me is sometimes I do that really well. This week has been pretty god-awful. My mood goes in cycles that sometimes I'm pretty good. As an introvert who's really happy being alone, being stuck in this house with my husband and my 4-year-old was not that bad the first 3 weeks. About week 4, I was just like, I need to get out. And so if you're not in the discipline of self-care before a pandemic hits, you're probably not going to be awesome at it right in the middle of it. And so reminding yourself and being really gracious with myself, like, it's okay that some days suck. It's okay that some days I just feel a little depressed, and I'm going to ride that wave because I know it's not going to last forever. And, today I feel a lot better than I did the past 3 days. And I'll probably feel even better tomorrow. And so just being okay with sort of the rhythm and the cycles, and trying to get back into the discipline of that self-care and that mindfulness.
I really appreciate that. We all live many moments of our days that are not Instagram worthy. It's good to be real about that. I'd love to hear one more thought on this area before we have a little bit of time before we move to the next topic.
I would just say that for me, usually the way I cope with stress is by working more, but somehow that hasn't worked this time. It's a very adaptive strategy for earlier times in my life, but not so much now. And so it's been interesting to have the experience of my tried and true strategy not really working this time. So had to find others. You know, making phone dates, because now Zoom is about work, he says on Zoom. I've taken up baking and then tried to take up walking because running seems too hard. Collecting and sharing kind of hilarious COVID-19 memes. I have a major distribution every morning. So trying to keep it light. If anyone's interested, just let me know. You too could be on the list. Yeah, just trying to make sure not to be too hard on myself for this being an emergency time that isn't going as planned.
Yeah, I definitely feel that also. I have been cooking a lot also, and I have been enjoying that. It looks like we've got a taker already asking for your meme distribution list. We'll get you hooked up. David Panelone will control your memes now and forevermore. But for me, you know, I've been cooking a lot also and baking. And then I think, you know, I go through these phases where I get too demanding on myself of those things, like, you know, to make 3 interesting meals, you know, then posting them on Facebook and all of that kind of stuff also. But no, I appreciate that. This is an interesting, different sort of time. And probably like you, I was working very hard right before I got sick, actually, and before all of this started. And so that has been a really interesting change. So while we're on the topic of learning about ourselves, that's my next question. So what has the pandemic given you the opportunity to learn about yourself? What ways have you grown as a person, or have you found things that you didn't know out about yourself? They don't have to be good things necessarily. Do you find out something you didn't know or, about yourselves through this journey? Here, I'd like to start. I'd like to go back to Darren, actually. You were talking when we talked earlier about having time and energy to invest in relationships and evolving ideas, like your idea about what it means to be invested and what it means to care.
Yeah. So I think I have to start this with the conversation about productivity, because psychology in general is this field where no matter what kind of psychology you do, you're always busy. I think that's just the nature of the field. And some people really thrive on having a lot to do. And David just talked about sort of like how I manage stress is doing more work. I'm not one of those people. I do not thrive on having a lot to do. I hate it. I love having my downtime. So productivity is really kind of tough for me right now because I don't feel like doing my work. Which is sad to say as a therapist, that, you know, it takes a lot more motivation and energy for me to get up, sign on, and talk to my clients. Now, when I'm on with my clients, a few minutes in, I just kind of like settle into it. It feels like home. I feel connected to my clients. And so, you know, I feel like I'm in good, healthy territory there. Like I'm not totally burnt out, but I am suffering with like this, I don't really feel like doing a whole lot of work. And so I was fighting that early on, and sort of, you know, kicking myself, bad psychologist, you're not doing a lot of work, and decided, you know what, but there are a lot of things I've been putting off in my personal life, because I've been doing so much work up until this point, that why don't you go ahead and just invest yourself in those things, because I'm not demotivated to contact my old friends that I haven't talked to in weeks, months, years. And part of the healing and journey for me has been having some time to think about some of those relationships, particularly with some of my queer friends that I have fallen out of favor with or contact with, and have not had the time to invest in calling up and saying, hey, so that thing that happened a couple of years ago that we've been pretending like didn't ever happen, now I actually can invest in doing that thing. And that's been wonderful. I've been feeling guilty about one of my really, really good friends who I was his best man at his wedding a couple of years ago, and it was a beautiful occasion, but I was poor at the time because I was ending internship. I was moving across state. We had just bought a house. And so I just couldn't get him a wedding gift. And I've been holding off on buying that gift for him. I sent it a couple days ago, and it was this very personal gift, a gift that I put hours of thought and prep into, and sent that off, and he totally loved it. And it just felt like a good reconnection and a healing with some of my queer community. So that's been, a wonderful thing. But I also have to admit that a lot of what I'm able to do because I'm privileged. And as a Black queer person, I'm thinking a lot about my siblings who are also queer and queer people of color who don't have many of the privileges and advantages that I do. I still have a paycheck. That says a lot right now. And I'm dealing with the guilt of like, why am I getting a stimulus check on top of my paycheck? And what do I do with that? And so a lot of my time and energy has been in figuring out where my time, my energy, my gifts, and my money can go to in the midst of all of that.
Yeah.
I just,
Arlene.
you asked an important question about, self-learning. And in listening to Darren from a practitioner point of view, having an independent practice, I found out on a Monday morning that I had been exposed to a positive COVID person. And on a dime, I had to close my practice. Like literally driving into work, I find this out. I show up, I tell my secretary, grab everything you can do to, work from home. I grabbed everything I could and went home. I've been fine, PS, I'm okay. But I had to take webinars on how to do telemedicine. I've never done that before in my life. And then how do you develop a practice as a result? Now, that was on March 23rd. That Monday. And so since that time, and I think that I'm on this listserv for a lot of psychologists here in Georgia that had to do that. It was a billing nightmare. It's been a huge, huge learning and stressful event. Thus the mindfulness stuff comes back. But anyway, I just needed to kind of bring in that for clinicians in a private practice, that whole business thing. It's really has been challenging. And so what you learn is, you got to adapt.
Mm-hmm. I should share my story there also. For those of you who haven't heard it, I am fine. I'm in very good health. But just before the social distancing orders started, before any of the shelter in place orders started, I was exposed to something from one of my patients, and I developed a severe cough and a temperature. I ended up spending 2 weeks in quarantine just to be safe. And so I likewise, my whole neuropsych battery was still in my office, and I had taken the cleaning wipes from my house to my office so I could use them there, and then I left them there, and all of this kind of stuff. I ended up spending about a week mostly playing Nintendo Switch, if I'm really honest, on the sofa. And recuperating, and again, that is a privileged dynamic, and it is also a privileged dynamic. But as I got involved in social media, a lot of how I was active in that time was trying to get scientifically based information out to people and help people navigate the information. I think probably a lot of people saw a lot of self-serving behavior on social media. Especially during that initial phase, everybody, and social media sometimes brings these things out in people, everybody trying to find a way where they're the worst person impacted in the world, by the current situation, or to try to, redirect attention to themselves or those kinds of things. And, I was doing some of that while also trying to get better myself because I didn't know what I had, and I wasn't able to get tested and all of those kinds of things. And it was a really interesting experience. And from a business perspective, I've been very lucky, and I think right now the impact over the full year will be probably 10 or 20% of revenue, which is pretty manageable. But it is a very uncertain time. And for me, I don't even have a secretary in my practice. And so I'm managing all of that myself. And it has been really interesting. And it's been a great study in adaptation. And I've actually, like, it's made me love being in a self-employed and having my own business in a way even more, even though I don't have a lot of control right now. Anybody else like to share anything about their learning experience with this?
One of the things that has been really difficult for me, I am a graduate student presently, has been really learning to rely on my community. I am a very deeply, stubbornly independent person. And so having to admit that I need help, whether that's from my fiance, from our roommate, from my cohort who I'm seeing virtually, from my good friends who live across the country, from my parents who are down in Florida, it's been hard to admit that I'm struggling, and it's been hard to admit that I need help. And one of the things that I think this time has taught me is that we have people in our lives who will show up for us. You know, whether they're sitting next to you or whether they are across a Zoom screen from you, they will show up, and you just have to ask. And so I think that that's been something that was really hard for me to acknowledge and admit, and is tough for me to say now, but has definitely been a big source of strength throughout this.
I think a lot of us are turning to people in unexpected kinds of ways. In my own neighborhood as well, we've had people who got together to make masks and to make sure that people had access to groceries if they couldn't get groceries. And it's been really tremendously heartwarming to see that. I do want to talk also about some of the downside and the negatives. And obviously, this is a very difficult situation. As I started trying to get information out to people, I had already been doing work. We received a question from one of our attendees. How do you reconcile with disparate responses to racial inequities and our own LGBT experience? And I'd already been doing work educating people about racial and ethnic disparities in healthcare and in mental health care, educating people about discrepancies in the way that people are treated in the autism space, which is one of the spaces I work in. And in other kinds of spaces. And so as I started sharing data, I was very sensitive to steering people towards information as it affected minority communities, helping to steer conversations towards the needs of the most vulnerable. You know, and I think people are vulnerable for different kinds of reasons, but, you know, focusing on the people who would really be negatively impacted. And for me, as a doctor, part of that conversation was as simple as I knew we needed to get people to a place where they were ready to shelter, where they were ready to socially isolate and those distance and those kinds of things. And to me, part of that was the most vulnerable people need to be supported because they have the least resources, you know, precisely the least resources to be able to make these kinds of adaptations. And, you know, big surprise, but for a lot of affluent people, this has been this weird kind of semi-vacation that is certainly stressful at times also, but involves a lot of baking and taking walks and enjoying nature and those kinds of things, spending lots of extra time with our loved ones and so forth. And so recognizing how different that is, you know, from the experience of people who don't have the ability to get their basic needs met in this kind of time. So talking about some of the challenges, I'd like to also recognize that probably people on this call are in really widely ranging points in the response. Some of you are probably serving in some kind of first responder or emergency role. Some of you are probably providing in-person, face-to-face services with appropriate safeguards. Some of you are probably doing telemedicine, as I am part-time. Some of you may be furloughed or otherwise inactive. And I know that I have psychologist friends who are furloughed and who are not receiving an income and so forth. So I'd like to give some space to talk about a sense of feeling sidelined. For me, I used to work in hospital settings, and that is a doubling of it, where it's very strange to me to not be in the hospital during a time like this. Do you all feel a sense of loss because you're not on the front lines, or a sense of wishing you could do more?
Yes, I know. Again, I'm a graduate student. I'm not a full psychologist. I'm still a trainee. But one of the things that has hit the hardest is our placement center stopped allowing us to see clients. And we also were not allowed to terminate with those clients. We didn't really have a way to get in touch with them. We didn't have a way to end session. We had our last day the Friday before spring break, which was March 13th. And then we were told we're not coming back. And so there feels to be a sense of loss. I know that I know this isn't similar for every single trainee throughout the country, but throughout our cohort, we're feeling a sense of loss. We're feeling a sense of the fact that we don't know what happened to our clients, that we weren't allowed to have that termination, and trying to think ahead to the future of what training sites will look like in the future. None of us at our placement have worked since March 13th. And so trying to figure out what that looks like in August, what that's going to look like for next steps, and really feeling like there are people out there who do need us and whose services we were providing, and we can't anymore. And I know that for me personally, that has felt incredibly challenging, and I felt ridiculously sidelined.
We received a question as we were talking. One of our attendees commented that she works in a university counseling center dealing with students who've returned to invalidating, unsupporting, unaffirming, and even unsafe environments. Some of these individuals were finding ways to cope pre-college, but it feels different to them going home in this current kind of environment. And I know some of you are providing telemedical care. Arlene is doing that. What about patients or clients who take a mental health step backwards, or regress or decompensate? Do you have recommendations? Do you have experiences to share from doing this work in this time?
I work primarily with children of Latino immigrants. And the clients that I have that are either sexual minorities or gender identity issues, that what happens is that they work so hard to try to get their parents to understand their journey. And but they have their social environment that affirms them, even if they come home and mom kind of grunts at the way someone is dressed, or the way, they've got someplace else where they are liberated and they have the freedom to be who they are, their authentic selves. And I'm having this difficulty in our sessions, at least. They know that they can be who they are with me, but finding confidential space in which to do it becomes an issue with the telemedicine. We have done telemedicine on walks to get some confidentiality, in their parents' car. And what they're describing is, while none of them is overt abuse, it's that subtle micro that doesn't feel so micro aggressions, take that pink and blue flag down. I don't want to see it in here. When it was over at their friend's house, when they went to their friend's house, they could be who they want to be. So coming home, sheltering in place has become sheltering in hell for a lot of them. And so providing, I think, in telemedicine, a safe space for them, and also allowing them to figure out how to keep connection with their peer group is really important.
Please don't. Yeah, go ahead. Sorry.
Yeah, I wanted to add on to that and to even kind of piggyback on some of what Lex was talking about. I can't imagine. I can't imagine the emotional furor that would come up for me if I was told I could not terminate with my clients. I just feel like that's a really, really hard thing to experience. And I fortunately, we're at a center where we have had the resources to be able to go online fairly quickly and continue our services. One thing we couldn't do though was we could not continue our group services. And I was running a group that I had inherited from Dr. Green a couple of years ago, an LGBTQ plus support group. And our group is made up largely of queer people of color. More than half of the group members are. Many of them from really economically disadvantaged backgrounds. Almost everyone in the group is not really fully out, but they have this safe space on campus, kind of like what Arlene is talking about there, where particularly if they're living on campus, they feel a little bit more freedom to be themselves, to explore themselves, their identity and identity development. And the group becomes this great space for them to work out a lot of that stuff. And so not being able to continue that has been a grief process for me and a loss. And it's inspired me to sort of push our leadership to, we need to get our groups back online, because I want to get this group back up and going for the people who can join it. And so advocating within our field and my leadership has been very accommodating, and they have listened, and they have put me on a committee to help spearhead getting us back online. And that's felt like I'm actually able to do something, because I feel so helpless and powerless in the midst of all that's going on right now. And so being able to advocate for them and get something happening has been good. And I'm still wrestling with what to do with, I've been in email contact with a number of those group members who said, I don't have a private space to go if we can even get the group back going online, and still trying to keep the gears churning inside to find ways to reach them. And sometimes it's been phone consultations with them just to check in. Many of my clients I've been seeing more than once a week, which usually our counseling center just we can't accommodate that. We have way too much, way too few resources and way too much traffic to be able to do that. But we've slowed down a bit because we're all online. And so I've been saying, let's do a couple times a week instead of once a week to help bridge the gap.
I think that really highlights as well that, our role as field advocates, and I think APA has done a very nice job of this as well, but advocating for medical coverage. That happened pretty well with this pandemic, although there are lots of gaps. There are still stories of people having difficulty getting insurance reimbursements for telemedical services. And it really, when a lot of the memes on social media said, you said I couldn't do my job from home every time I asked you for years and years when I had other things come up, and suddenly there's a virus, and next thing you know, I'm at home working. And so apparently I could do my job from home. I think emphasizing that telemedicine is an effective service in a lot of cases, but then also emphasizing that psychological services are essential, that they are medically necessary, that there can be crises in which we need to be adaptable and flexible and find the ways to support people. And I think that's a thing that, that in this kind of a crisis, it's an opportunity for us to continue advocating for the people that we serve in that kind of way. Here in Michigan, we had a long conversation about how to do autism evaluations via telemedicine, and I'm actually doing that. And that's a winter wonderland. It's a very kind of strange experience, and I don't know what I think about it. But when it comes to the broader range of services, sometimes what we have to do as psychologists is say, this should stop. In fact, in the neuropsych field, I think a lot of the argument was sort of people were saying, you are trying to convince yourself that your work is essential because it affects your paycheck. And that's not the right reason to make these decisions. But on the other hand, sometimes these services are really critical, and we should be advocating and supporting in those situations. David, I know that you are also doing some work to support other first line responders, and I certainly think that psychologists are essential workers, and some of us are doing frontline work. But you're doing something really interesting to support our medical peers.
Yeah, there's a colleague here in Boston made a group, the Emotional PPE Project, and started off as a pilot within Boston of licensed mental health providers volunteering our time to support frontline medical staff. So at first it was just like nurses and physicians who work in ICU, critical care, medicine, providing, so the service is just a connector of those folks to licensed providers who are willing to volunteer our time to provide services to them. But it really took off both in terms of demand and in terms of supply, which is lots of folks around the country were wanting to get involved, and that there's a dire need, clearly. And so the group is well on its way to nonprofit status. And the last update I got was that there were about 100 providers who had volunteered to be part of that. And so I've seen other just like folks forwarding around other groups like that are forming, because I think, you know, now that we're kind of 8 weeks into this lockdown, it's really clear that some of the strategies that we've all been using to kind of white knuckle it through the, you know, it's just not working that well anymore. We're past that now, and we need strategies part 2. And that for some people, you know, maybe that is like a mental health services in that, in this kind of virtual format.
Yeah, I know, and I know that this is a broader issue. Like many of you have read the news articles about early in the COVID situation, the significant reductions in cardiac admits, and you know, people were asking, where did all the heart attack patients go? And certainly mental health crises don't go away during these times. If anything, they're worse, probably. And so I think you're exactly right that that we have a role to play in supporting people out of the immediate crisis response and into the long-term response. It highlights some expertise that we have. You know, we are experts in change, right? In change management and supporting people through change. We're experts in human creativity and human potential. Well, I would love to hear one more thought on this issue of loss or feeling sidelined, and then I'd like to make sure that we spend some time on some of the questions that we've received or comments. All right. Well, we touched on this a little bit, but I do want to go back to this issue of racial disparities and inequities, and ask as well if, especially for those of you who've been active in the LGBT community for a longer period of time, if you see parallels between what is happening now with other minority groups and what happened to LGBTQIA plus people in the past, or even today.
That question feels too broad. I feel like I could talk for an hour on that. I think one parallel that I have seen pre-pandemic and has been made worse by the pandemic is the narrative focus on cis gay white men. And that is an identity that certainly has, you know, its share of oppression, but a complete neglect of queer people of color, particularly economically disadvantaged queer people of color, and that has been devastating, I think, for our community. This pandemic has had a disproportionate impact on them. And so I think that I want to spend a lot of my time sort of thinking about that group of people and raising my voice and advocating for them, and not just for the narrative of the cis gay white male.
Sure. We have a comment that I will read from one of our colleagues in Puerto Rico. But when you think about Puerto Rico is a great example. There have been multiple murders of trans people, LGBT people more broadly in the last few weeks. And certainly there have been some high-profile bias crimes in the mainland during the last few weeks as well. And so recognizing that those groups face multiple challenges, that they may be uniquely likely to be underserved, not taken seriously, and so on. And certainly, like, if there's trans broken leg or trans broken arm, then there can be trans COVID also, and those kinds of problems that people can experience. The comment from our colleague in Puerto Rico, I'll read, is that they've been facing difficulties with sexual minorities as well. Graduate schools and clinical practices are shut down. And there's interest in telehealth, but a lot of individuals in that part of the country don't have access to the internet, to smartphones, or they have limited data plans. They're dealing with homophobia, transphobia, biphobia, et cetera, within their families, but then also they're dealing with the earthquakes and approaching hurricane season. And I would love to hear any thoughts about those unique challenges.
It seems daunting, doesn't it? Just everything that people in Puerto Rico have had to contend with. And so to add this on top of it, it almost feels almost insurmountable. And yet, knowing the people of Puerto Rico the way I do, incredible amounts of resilience and the ability to find community. How is it that people do find community in real time? Because family isn't always there for you. As I mentioned before, here in the States, same thing, with the Latino community. I don't have any solutions for that, except feeling incredibly taken by the difficulty of the situation.
Yeah. I think that we need to push for broader solutions, and we have to be creative. Like, maybe therapy has to happen outdoors in the parts of the country where that's possible, which is Michigan right now, but not always Michigan. And we need to think about these other kinds of solutions, and then we need to advocate systemically. Certainly all of us on the mainland need to continue advocating for the needs of Puerto Rico. There were some positive changes that began happening right before COVID with the debt crisis and the unique debt situation that Puerto Rico's in. But continuing to advocate is very important. And then certainly, some of my colleagues from that part of the country have been reaching out for help. But those of us who are able to offer support, whether it's technical education to colleagues in Puerto Rico or other hard-hit parts of the country, whether it is social connectedness and peer support, those kinds of things are things to think about maybe as well. So another one of our attendees made a comment that this person doesn't feel the sense of loss that we're discussing, but they do struggle with being able to get support and talk openly about their struggles and challenges. In particular, this person talks about how they see themselves, they consider us as frontline workers and essential workers, but feel shamed or admonished or silenced when they voice that experience, because they are, quote, not the real heroes, end quote. I have a thought about that, and would love to hear from all of you. Which is when I was posting on social media early in this and tried to get people thinking, in ways that are productive about COVID. I was commenting about the epidemiologists, and certainly they are very important in this. And one of the comments that I made that seemed to resonate with people was that the ideal world for them is that they make this prediction of how bad it could be, and we act, and it isn't so bad because we acted, and then we all think they're idiots for having said that it would be bad, but they know that we're alive because of the work that they did. I think it's important for us to recognize each other. We don't always get the pat on the back that we need from people outside of our profession, but sometimes you're the only person who knows the heroism that you have been putting forward in this situation.
It's the hard part about being involved in prevention, right? When your job is successful, the feared thing didn't come to pass, and so you don't know outside of a controlled experiment whether it might have happened anyway, right? But I just keep thinking about some of the other questions that folks have typed in, this, if I may, this idea that's like what should we be saying to our, sexual and gender minority clients, friends, to ourselves about how to cope during this time. And it just makes me keep thinking about the literature on trauma exposure, which is the thing you do when a trauma is going on. Those are a different set of skills and strategies than when it's over. And so I think part of what's hard is, we're usually really good at helping people about how to work on the trauma exposure when it's over, when they are safe, right? When it's not happening, and that this is a unique situation in that the trauma doesn't usually last for 3 months. And I mean, for some people it lasts forever, based on whatever their situation is. But I think for so many of us, it's partly why it's so hard, which is the things that we usually do. Haven't it's hard to know how to advise folks, and it makes me think of, like, for the other DBT therapists out there, like the way that I would coach a client in using crisis survival strategies, for example, like during a crisis, and then I kind of peek at them and I'm like, that's not this, that doesn't fit as well here. And so just to really validate for all those frontline folks out there that are like not really sure what we should be saying and doing with our clients, just to really, I see you and feel that too.
And on top of what you just said, David, that we as the helpers here are also experiencing this, which is different than when we're coaching somebody through a their own trauma, and we could have that sort of, psychological, we're not, certainly we can have vicarious traumatization at another point, but we have not had that experience. We are in real time experiencing what our clients, the COVID anxiety and the depression and being locked in with our families. And, we have this level of understanding, and yet can we see past our own experiences to be able to?
Right. And it's okay if the answer is sometimes yes and sometimes
no.
Yeah. No, I think that's very good. I want to try, so we have a few minutes left. I want to try to touch on at least a couple of these other questions. I want to ask, is there anybody on the panel that's teaching during this crisis?
Yes. I am presently teaching, and I am presently working on integrating. This is actually at the university that I am at currently, this is my first independent teaching experience. So I am starting from scratch, learning to create a syllabus in the time of COVID. I think, and I'm looking at the question that stated that, how are folks navigating the complicated balance of facilitating student learning, as well as being compassionate and understanding of their unique circumstances at this time? And for me, I'm relying really hard on compassion. I think I'm still a student myself, so I would want my professors to give me a lot of grace and a lot of space And I don't know what's happening with my students. I live in Tennessee. A lot of my students might live in rural Appalachia. They might not have good internet access. They might be sharing one laptop between 5 family members. It is not my job to make sure that they have the Introduction to Psychology book memorized. It is my job to make sure that they have a little bit of a sense of normalcy, that they have their learning outcomes met, that they have some big picture ideas taken away, maybe that they have good ideas about critical thinking and understanding and scientific method. And it is my job to know that they are humans and to also be a human with them and to show them love and grace and compassion in this time that maybe they're not getting it from the people they're directly with. And even if they don't know me personally, the best I can do is be compassionate.
I'm not teaching right now, but amen to all of that. That I think is so true. I get students on the other end where they're telling me about how their professors are responding to them. And fortunately, many of my clients, professors have been extremely understanding and graceful, and I've appreciated that. But some professors have been like, well, no, but you need to do all the tasks. And they've increased the workload because like you're at home, so you have more time. And I'm just like, clearly you've never opened any amount of research on psychology, that we're socially isolating ourselves. We have a lot of research on what social isolation does to humans. It makes them feel less productive. It makes them feel more anxious, less able to cope with their emotions, more depressed. Our students are struggling, and we need to be with them in the midst of that and understanding. And sometimes that means going, you know what, that assignment, that's not the end all and be all of this experience right now. Let me be here with you as a human together in this. So good for you, Lex.
I think that yeah, let me echo that as well. So we are ending at 7, right? Okay, so we have received a lot of questions, and maybe we should talk about doing some more of this and having a deeper conversation. Send me questions, Mira at miracharlotte.com. Reach out to me and I can bring those together and we can figure out what the next steps are. But I want to touch on a very important question that I see in the Q&A, which is, outside of chats like this, do you know of any support resources where us psychologists can seek this sort of emotional support? Particularly, the person said, free of professional consequences and short of our own psychotherapy. And this is something our EC has been talking about. If there is a need for making a peer mentorship network available with confidential resources for people in our division, for providers more generally. Are people interested in that?
Let me tell you my experience this past Saturday. Division 42 is psychologists in independent practice. And I really think that 44 could do. Basically, it was a group of people in practice and we just talked about the issues that we're confronting and what it feels like to be anxious and work with somebody who's anxious. And these are colleagues. There's no professional consequences. There's no, supervisory or, and it was a really wonderful experience. And I think it would be great if Division 44 can do it in a variety of different, formats.
Gary was able to join us, our division president, and he's messaging that he has been talking about this, and so we will definitely follow up. If I could figure out how to pull Gary in as a panelist, I would, but I don't know if that's possible. But we will definitely have that follow up, and we will also capture any questions that we didn't get to in the chat or in the Q&A. We want to thank you all on behalf of the division and this panel. I want to thank you all for being a part of this. I want to thank Darren, David, Lex, Arlene for your thoughts and sharing your experiences so authentically and transparently. I'd like to thank Carlton and Melissa for putting this together. I really enjoyed this, even though I'm waiting to get dinner started and all those kinds of things. This has been a lovely way to connect, and and grow as a psychologist. So I want to thank you on my own behalf as well. All right, everybody, tune in for more. We should be able to also have this, make this available to you via YouTube. We'll be doing that shortly. And so if you missed part of it or something like that, or if you have colleagues who missed this, we'll make this available. Reach out to me again if you have ideas, and we'll keep this conversation going. All right, thank you and good night. Bye-bye.
Thank you.
Bye.